Simplicity that makes sense. SimpleLogic, the implant system designed to be intuitive and easy to use. SimpleLogic offers visual verification of the correct seating of components, color coding for matching components at a glance, and an innovative preparation coping for easy intraoral adjustments. Plus, SimpleLogic uses 3i's patented OsseoTite microsurface with a gold-colored titanium nitride-coated transgingival collar for improved aesthetic appearance. SimpleLogic is TG made easy. SimpleLogic. Simplicity that makes sense. In the following step-by-step, we will illustrate the placement of a TG OsseoTite implant and the completion of the restoration using SimpleLogic. After implant placement, the implant mount retaining screw is then loosened. The implant mount is then unscrewed from the implant. The cover screw is then placed on the implant. The patient is then sutured and sent home to heal. The healing process can take as little as 2 months with the biologically driven OsseoTite surface. After the soft tissue has matured, TG try-in posts are used to evaluate which post to select. Once the post height is determined, the appropriate TG post can be torqued into place. The TG lock cap is then placed on the TG post. Seating of the TG lock cap can be visually verified by looking at the TG post lock ball. If the TG lock ball is not visible at the top as shown here, the lock cap is not seated properly. Like the lock cap, the TG post impression coping positively engages the lock ball, visibly assuring proper seating from the top of the coping. There is no need to prepare the post prior to taking the impression. Simply take an impression of the unprepared post. After impression taking, replace the lock cap. The impression is now sent to the lab. The lab technician then determines optimum shape and creates a template using a preparation coping for intraoral preparation before delivery of the restoration. The appropriate TG post lab analog is placed into the impression. The TG lab analogs are also color-coded for simplicity. This ensures that the proper height is used. The model is then poured. The TG post preparation coping is then placed on the post analog. The laboratory will modify the size, height, and shape needed for the finished TG post. The final restoration is then fabricated and sent to the restoring doctor. At the patient's next visit, the lock cap is removed. Then the lock ball is also removed. Next, the TG post preparation coping is placed on the TG post. The area of the TG post that is above the template is removed. The TG post preparation coping is taken off the post. Now the final prosthesis can be cemented on the TG post. SimpleLogic. Simplicity that makes sense.